Today we're talking about one of the most complex, hardworking, and just absolutely essential joints in your entire body, the wrist. It really is the unsung hero that connects your hand to your arm, and it makes pretty much everything you do possible. But here's the thing, right? For a joint that's so incredibly capable, it's also one of the most common spots for pain, stiffness, and injury. So what is going on inside this small but mighty part of our anatomy? Well, let's find out.
First up, let's just take a second to appreciate what the wrist actually does for us. Its hidden superpower is its insane versatility, which, let's be honest, we all take for granted until something goes wrong.
I mean, just think about your day so far. From typing that email and lifting your coffee cup to gripping a steering wheel or playing a video game. Almost every single thing you do with your hands. It all depends on the strength and the flexibility of your wrists. They're the pivot point for pretty much all of our interactions with the world. Okay, so to really understand why this joint is so powerful but also so prone to problems, we've got to look at the blueprints. Let's peel back the layers and see what makes the wrist tick. So the wrist's whole story, it basically begins with two bones. These are the long bones in your forearm, the radius and the ulna. They act like these structural pillars connecting your arm to your hand. You can think of them as the powerful foundation that everything else is built on.
Now here's where it gets really wild. There are an incredible 8 small carpal bones packed into your wrist, and they're arranged perfectly in 2 rows. It's this collection of tiny, cleverly fitted parts that gives your wrist its amazing dexterity. You know, its ability to move up, down, side to side, all around. This is where the magic happens. This is the source of its superpower.
So how is this whole complex structure held together? Well, you've got 2 key players. Ligaments and tendons. A really easy way to think about it is that ligaments are like strong tape. They connect bone to bone and give you that crucial stability. Then you have tendons, which are more like cables, and they connect your forearm muscles to your hand. They're what lets you actually move your fingers and your wrist.
So you put it all together, and you have this incredible system just working in perfect harmony. You've got the big bones for structure, those 8 little carpal bones for that amazing dexterity, ligaments for stability, tendons for movement, and finally, these critical nerves that act as messengers, shooting signals for feeling and motion back and forth from the brain.
Now, this super intricate design is exactly what makes the wrist so versatile, but it's also its greatest weakness. You know, with so many moving parts in such a tiny space, it's pretty easy for things to go wrong. So let's look at a few of the usual suspects when it comes to wrist pain.
All right, here are 3 of the most common culprits. With carpal tunnel, you get that classic numbness or that pins and needles feeling because the main nerve, the median nerve, is getting squeezed. Then there's tendonitis, which is when those mover cables, the tendons, get inflamed, usually from overuse, causing pain when you move. And of course, arthritis, which is basically the wear and tear of the joint itself, and that leads to stiffness and swelling.
And for carpal tunnel especially, the cause is often something so many of us can relate to. Just repetitive motion. All those hours of typing can put a ton of pressure on that median nerve. What's interesting too is that it's also really common during pregnancy because of fluid retention, which increases the pressure inside that narrow little carpal tunnel passageway. Ever seen one of these? A ganglion cyst? It's this little fluid-filled sac that could just pop up on the wrist. And while they might look kind of alarming, the good news is they are almost always totally harmless. They really only become a problem if they get big enough to press on a nerve and start causing pain. Okay. Enough about the problems. You know, the most powerful thing we can do is be proactive. So let's shift gears and talk about how to protect your wrists and stop these issues before they even have a chance to start.
This is your daily defense plan right here. If you work at a desk, keeping your wrist straight, not bent up or down, is so important. Those ergonomic pads can really help you stay in that neutral position. And remember to take frequent, short breaks to stretch. Oh, and when you lift something heavy, use the power of your whole arm, not just the delicate muscles in your wrist. And here are some super simple stretches you can do, like right now. Just make a fist and gently roll your wrist a few times in each direction. Then stretch your arm out and gently bend your wrist down, and then up, holding each stretch for just a few seconds. Honestly, this little 2-minute routine can work wonders for staying flexible and getting rid of tension.
But what if you're already feeling that twinge of pain? Whatever you do, don't ignore it. Let's finish up with some smart, practical steps for getting relief and for knowing when it's time to call in a professional.
So your first step is knowing the difference between what you can do at home and when it's time for a doctor's visit. For a minor strain, your first line of defense is simple. Rest the wrist and put some ice on it to reduce the inflammation. But there are some clear red flags. If the pain just won't go away, if it's really severe, or if you're getting numbness, that is your signal to see a doctor. And of course, anytime there's a clear injury, like from a fall, you need to get that checked out professionally.
And we'll end on this thought. From the second you wake up to the moment you go to sleep, your wrists are constantly working for you. They are a true marvel of biological engineering. So the question to take away from this explainer is this: what small changes can you make, starting today, to support them back?